Hello, Janet. My name is Dr. Randy Craig. I'm a community-based palliative care physician. I'd like to congratulate you on your new role in the COPD clinic. This is a disease process we're very acquainted with in palliative care. In regard to your question about identifying patients early who need interventions, I like to think of the disease trajectory as I consider providing care for a COPD patient. Realizing there's a lot of variations from patient to patient, and because of that, there's a lot of uncertainties in what to expect early on. The functional decline happens really slowly, so patients can present late in the disease process. Small changes in lung function can result in large changes in functional capability. These all make it easy for providers to be surprised by their patients. I like to look at key transition points to discuss palliative care with patients, not refer, but at least to discuss. One is the start of new and different treatments. The second is the lack of further or additional life-prolonging treatment options. Functional decline is another transition point, and frequent exacerbations, increases in frequency or increasing hospitalizations. Now, indications for palliative care consultations would include supplementation with oxygen, functional impairments. I mentioned this in the transition points. In regard to functional impairments, I like to use time markers to help determine functional decline. As an example, I may ask, hey, what'd you do for your birthday? What'd you do this year? What'd you do last year? To get a feel for how stable they are. Another indication for PC consultation is unintentional weight loss. And lastly, the question, would you be surprised if this patient died in the next 6 months? And it may be helpful to also realize that a decline in walking distance in 6 minutes to less than 50 meters is a sign of late disease. So of course that would be an indication for intervention. Worsening hypoxemia, increasing CO2, and the impairment of the ability to leave home because of COPD symptoms. Those are more prognostic signs for late disease. But again, if you're there with the patient, intervention would be appropriate. Now, it may also be helpful, even though these patients are not ready for hospice, knowing a little bit about hospice criteria. You can look at that and then work back to identify patients who may need intervention. One is a disabling dyspnea at rest. A second is increasing visits to the ED, increasing hospitalizations, increasing the home visits. Third, hypoxemia at rest, and there's specific criteria for that. And also unintentional weight loss of greater than 10% body weight over 6 months. And finally, a resting tachycardia of greater than 100 beats per minute. I hope these comments are helpful, and please feel free to contact me with future questions. I'll be happy to work with you, and we'll look forward to you working with us in the palliative care community here in Denver.